You've probably heard someone talk about having a gallbladder attack, that sudden, intense pain that just comes out of nowhere and can completely floor you. But what's really going on inside your body to cause all that? Well, let's dive in and find out. So, that really sharp pain, it's basically your body's alarm system going off, and it's pointing to one very specific spot, a small, pear-shaped organ that, believe it or not, plays a huge role in your digestion. The official medical term for this is cholecystitis, and really all that means is an inflammation of the gallbladder. Now, this little organ's whole job is to store bile, which helps you digest fatty foods. But when it gets inflamed, oh, it definitely lets you know. Okay, so it all kicks off with that classic sharp pain, usually in the upper right part of your belly. But to get why it hurts so much, we've got to look at what's causing that inflammation in the first place. It turns out there are actually two ways this can happen. The most common one, by far, is called calculus cholecystitis, and it's caused by gallstones. But then there's acalculus, which is inflammation without any stones. That one's pretty rare and usually happens to people who are already really sick from something else, like a major trauma or infection, that just causes the gallbladder to malfunction. So just how big of a deal are gallstones in this whole story? Get this. They are the culprit a whopping 95% of the time. Yep. For almost everybody who gets this, the problem starts with one of those tiny little stones. All right, so here's the best way to picture what's going on. Think of it like a traffic jam. A gallstone gets lodged in the cystic duct, which is basically the gallbladder's only exit route. So the bile has nowhere to go. It gets all backed up, pressure starts to build, and that trapped bile begins to irritate and inflame the gallbladder wall. And that's where that awful pain comes from. Okay, so if gallstones are the mean troublemaker here, the big question is, who tends to get them? Let's take a look at the risk factors and see who's more likely to run into this problem. Now, you may have heard of the old medical shortcut, the 4Fs. But, while those things can be factors, the real picture is so much bigger. The risk factors also include things like obesity, having type 2 diabetes, a family history of gallstones, and even losing a lot of weight really fast. So the truth is, this can affect all sorts of people. So, picture this. Someone shows up in the ER with that classic gallbladder pain. How do doctors go from that symptom to being 100% sure what's going on? It's a really interesting and pretty logical process. It all starts with a physical exam. A doctor might check for something called Murphy's sign. That's when they press on the area, and when you take a deep breath, the pain gets way worse. Then they'll do some lab work to look for a high white blood cell count, which is a big clue for inflammation. But the real confirmation, the clincher, is an ultrasound. It lets them see the gallbladder right on the screen and spot any gallstones causing all the trouble. All right, the diagnosis is confirmed. Now the big question is, what do we do about it? When it comes to cholecystitis, the best way to solve the problem for good is to remove the gallbladder. Back in the day, this was a major operation with a big incision and a really long, tough recovery. But today, it's a completely different ballgame. The modern way to do it is laparoscopic surgery. Instead of a big cut, they use a few tiny punctures. And what does that mean for the patient? A much faster recovery, way less pain, and a lower risk of any problems. Because of all those benefits, laparoscopic gallbladder removal, or lap chole as it's often called, is now the absolute gold standard. It's actually one of the most common surgeries out there, and it's done safely thousands of times a day. I mean, it really all boils down to this, right? Patient recovery is quicker, postoperative pain is less severe. At the end of the day, that's what truly matters, and it's just a massive improvement thanks to modern medicine. So the surgery is done, the gallbladder is out, and that awful pain is finally just a memory. What comes next? What's life actually like after you recover? Honestly, the best news is that for most people, the recovery is incredibly fast. You're usually back to your normal self within a week or so. And the number one question everyone has, what about my diet? Well, there's no special long-term diet you need to follow. The advice is really just common sense. Take it easy with fatty foods at first, and just listen to your body to see what it can handle. Now, it's worth knowing that for a small number of people, they might experience something called post-cholecystectomy syndrome. This is basically when some of those old symptoms, like abdominal pain or digestive issues, pop back up, sometimes weeks or even months after the surgery. It doesn't happen to everyone, but it's good to be aware of. So the key takeaway here is super simple. Listen to your body. If you start having that same kind of abdominal pain again, or any new digestive issues after your surgery, don't just brush it off.
That's your cue to give your doctor a call and get it checked out.
And this whole thing really makes you think. A gallbladder attack is such a clear, loud signal from our body that something is wrong. It kind of makes you wonder, what other signals, what other pains might our bodies be sending us that we really shouldn't be ignoring?